Women Affairs and Child Development, in collaboration with the United Nations Population Fund, embarked on a two-way capacity building for coordinators of gender-based violence referral network across the 20 local governments in the state, aimed at reactivating them to stand up to the responsibilities of managing cases of GBV in their locality. The training, according to Gender Desk Office of the Ministry, Mrs. Esther Patrick, who is also the UNFPA project in the state, will also increase awareness and uptake of maternal health and services, as well as gender support of key decision makers to support and advocate for women and girls. A Bauchi State correspondent, Awa Hassan, completes the story. Take a look.
Women are longing to be free, no longer in the shadow.
The Bauchi State Ministry of Women Affairs and Child Development is seriously concerned about the issues around gender-based violence and harmful traditional practices. In spite of the government's effort coupled with the support from implementing partners to address GBV in the state over the years, of which successes are being recorded in some areas, still, there is the need for more support from the relevant stakeholders. Gathered here are coordinators of gender-based violence referral network from the 20 local governments of the state for a two-day capacity building organized by the ministry in collaboration with the United Nations Population Fund, UNFPA.
We didn't have much to communicate with them, but still they were doing their job, because mostly we normally get report from them on what they do because of lack of resources. That is why it became very silent. But now with the support of UNFPA, we are now trying to activate them to see how we can start working, treating cases of, managing cases of GBV, because we already have our referral team on ground at the local level, 10 men member who are into GBV cases.
The trainees are expected to cascade down the training when they go back to their various local communities. And as such, there is the need to be acquainted with the health aspect of the gender-based violence. The State Ministry of Health was also part of the training to give their inputs.
For rape, I think usually, it's a capital offense, it's a state case. So, and you can't make a case out of it without medical report. It's one of the first things that you can establish your evidence with. So for health aspect here, we are trying to equip our service providers ranging from doctors, nurses, and our other relevant healthcare workers at the facility level to know how best to handle GBV cases.
The Ministries of Women Affairs nationwide are mandated to see how it can report all GBV cases to the national dashboard so as to have a comprehensive data and send to donors to have access and give support to any state that needs. Hence, the need to activate this group.
So by activating this group is to see how we can be able to teach the women how to fill our incidence form, bring it back to the ministry, we compile the data, and now post it to the dashboard for any donor to see and give support to Bauchi State.
Some of the participants say they have a lot to take away home from this training.
Well, for these 2 days of training, my takeaway home is to implement what I've learned from the training. That's to reach to communities that are hard to reach and to the people that are not able to get to know this information on the menaces gender-based violence causes in the community.
And I learned a lot. Basically, more especially now in the nutritional values, how we will go and inform our people from our communities how to balance their diet.
The training also seeks to develop key messages for gender-based violence, family planning, child marriage, and maternal health, among other objectives. Awol Hassan, Viewer TV News, Bauchi.